Many of you don't know that, over the last decade and a half of practice, at one point I used to treat a bunch of adults. I used to treat people with lupus and rheumatoid arthritis, and I've seen kids with autism and so forth. And over the last decade to a decade and a half of being in the field of medicine and in the field of integrative medicine, there are one of a few things that really give me the heebie-jeebies. Like, I don't get paranoid about many things. Like, to my wife's dismay, she's like, "What about this?" I'm like, "It's not a big deal." "What about that?" "It's not a big deal." There is one thing that is a really big deal, and I can't underline this enough. Like, I don't get paranoid. There's one thing that is one of a few things that causes me to get paranoid. There's one of the few things that causes me to lose sleep. And this is something that every single person out there, all of you, need to be aware of. Chances are, amongst our audience in our community, there are more than a handful of you that are being affected by this. And it is something that very few people know about. It is something that we have very little awareness about. And if this thing is in your home, it can cause rather destructive, horrible consequences that can cause a lifelong state of illness, misery. It can cause your kids to fall apart, and it can cause serious, serious, serious health complications. Now, this is an area that I'm not the master in, and I am privileged today to have who I see as a master in this field. He is one of my mentors, and he is the man that wrote this book. So what we're going to talk about is mold. And I am so honored and pleased to actually share with you the author of this book, this brilliant man, Dr. Neil Nathan. Dr. Neil Nathan is the doctor's doctor that people go to see when they don't know what the heck is going on. And his entire career has really been built around like the mystery cases. He's the Sherlock Holmes of the medicine of complex cases. And through his work in this field, he has gathered this incredible wealth of information and knowledge that he shares in his book, and he's going to share with you. So with further ado, Dr. Nathan, I'd love to see if you want to share anything with your audience. And then from there, let's get into mold and why it's such a big deal and why every single person out there needs to know about this.
Oh, thank you. That introduction leaves me with the feeling of, gosh, no pressure. I sort of have a brass band and a sort of music playing in the background. So thank you for that very kind introduction. I appreciate that. And I'm happy to share with your listening audience what I've learned over many years. This is actually going just about my 50th year of practice. Translation, I'm old. And but I hope during that period of time I've acquired experience with helping people who were unusually ill that conventional medicine didn't have answers for. And over the years, we've tried to look for answers when the large institutions of medicine would analyze these people upside down and backwards and go, gosh, I know you're sick, but I don't know what you have. And for whatever reason, that became my area of expertise. I am one of those odd people who likes challenges. I like puzzles. So rather than being intimidated by complexity, my response is bring it. Partly because that is how I have learned over the years. It's by knowing how little I know and realizing how much I need to study and learn more that I've just grasped the need to dig deeper. And I'm hoping that that information will be very useful.
I love it. I love it. I appreciate what you bring up because it is my most complex patients that have taught me the most. I guess I'm similar in that sense. I really love working with patients who who are really sick. I mean, I love my general pediatric patients, and I love just watching some of my kids in the practice grow up. But there's also something to be said about the kids who are really, really sick and really push us. And that's what ultimately led me to you. It was, I think, 3 years ago when I found you. And I had this, or maybe 2 years ago, where I had this one guy that I couldn't make any sense of why he was sick, and all of my regular bag of tricks were failing. And then finally, I came across your book, and then I connected with you, and you're like, "Yeah, this is mold." And sure, long behold, that little guy is actually doing much better. My first patient that led me to you, and he was the one, and thanks to you, that my eyes got opened up, and now I realized that mold is everywhere, that this
Yeah,
isn't like a rare one-off thing, right? This is
it
actually
is.
way more common.
It's actually estimated that up to 10 million Americans have some degree of mold toxicity at this point. It's an epidemic that dwarfs things like AIDS. I mean, AIDS never affected anywhere near that number of people. Um, and it's estimated that perhaps, this is scary, I know you said it was scary, but it's
Mm.
estimated that perhaps 50% of all buildings in this country have some degree of mold contamination in them. So this is not a rare thing. Fortunately, not everyone who's exposed to mold will have mold symptoms. It depends a little bit on your genetics, a little bit on the amount of mold that you're being exposed to in your environment. So it's not rare. This is common. And unfortunately, it's not well known in medicine. And I don't know if I can explain why, because I get asked that all the time. Well, okay, one of my favorite comments from physicians is, well, if this was true, I would already know this.
Mm.
And I kind of go, um, I'm sorry. So there is nothing new in this world. And if it was important, you already would have learned it in medical school. I'm baffled by that comment, but many, many physicians feel that way, that if something were important, their peers and colleagues would be telling them about it.
Mm.
And
Mm.
so, I mean, I've been trying to tell my peers and colleagues about this for 15 years now. And it goes slowly in medicine. As you
Mm.
know,
Mhm.
the whole history of science and medicine is that new technology gets embraced rapidly, but new information, not so much. New information, it's like, I don't know if I truly accept this. I'm going to stick around until some um, vaunted board of physicians gets together and agrees that this is real, and then they tell me that, and then I'll believe it,
Mm.
as opposed to believing your own experience,
Yeah.
in which you've got a sick person, you realize what the cause is, you treat it, and they get well. That ought to be the model we work with, but it's not. We almost rely too heavily on some magical get together of experts. And those experts are not always open,
Yeah. Yeah.
shockingly.
Yeah. And I think it's that we have a system that's based on one way of looking at things. And I can relate to this because I find that this is something that's actually existing in all models of medicine.
Hmm.
You go to, I'm an osteopath, and if I were to go to an osteopath and say, "Hey, this thing that you're doing osteopathic medicine on is actually blah blah blah," they'll be like, "No, but I've been able to fix it." So I find that everyone kind of sees the world through their lens. And when you say, "Well, actually, that lens may not be the best lens. Maybe you should try this other lens," they'll be like, "Well, no, this is the lens I use." And for me, it's been fascinating because I'm kind of an odd bird. I've kind of jumped from one world to another, to another, to another. And, I've really tried to assimilate how a lot of people see things. And I then take that on and then keep testing it to see how it shows up in my patient population, and what are the more relevant lenses, what are the less relevant lenses. And one of the things that I have found is some of the stuff that you and Dr. Shoemaker have taught are really important lenses that everyone should know about, hence why we're here. Now, one of the things that I actually came across, I think you touched on, like, what people say, "Well, why is it that we don't know about this?" I was reading this article that was talking about how up until the 1950s and 60s, they were actually still using plaster to really do the inside of the homes. And it was only in the 1950s, really 60s, that drywall took off. And for you folks, if you want to see what a Petri dish looks like, drywall is basically paper squished together. Add water to paper, water to drywall, you get a Petri dish. You add water to the inside of your home, that is the perfect recipe for mold. It is like they literally have lined the homes in the United States with Petri dishes. And that is why this is what I've realized. And I'm sure you have your own theories, but this, when I read this, I'm like, oh my God, like, wow, I didn't realize that drywalls were such not a great idea. And in other parts of the world, what's really interesting is they don't always use drywall. They still use plaster, and plaster is basically concrete, and mold doesn't really grow on concrete. So I thought that that was a really interesting, which also makes sense because, I mean, 50 years, 60 years is not really a huge amount of time for us to become cognizant of a problem because it wasn't really there before in the same sense. I don't know if you have other thoughts of why maybe we've kind of created this wonderful pandemic.
Well, I do. First, let me expand on your description. Um, the paper that is used as the backing for drywall is made of basically tree bark. So imagine that you're taking moldy tree bark and powdering it. And so when you say just add water, it's like a petri dish. You're adding water to dormant mold. It's already there.
Oh.
It's already there. So I just wanted to expand on that understanding. But other factors go into place as well. The energy crisis in 1979 changed the way we built buildings. So instead of having them ventilated and open to air where things would flow through, we closed them up so that we'd be more energy efficient. We changed the structure of buildings. We insulated to the nines so that there's no airflow. So once you do get mold growing in it, there's nothing to remove it as you would in a natural environment. Things flow in, things flow out, not anymore. So in the homes that have been built since 1979, if you do have a water damaged component of that building from anything, leaking sink, leaking shower, a water heater that's leaking, or a leak in the roof or the wall, or you name it, doesn't matter how you get it. But there's more. And this is where you get into scary. Despite all of that, I believe we are seeing more and more and more illness caused not only by mold, but by all of the exposures that we have in our external environment. And what I'm saying is the world that we live in is increasingly polluted. We have been adding without evaluating them. There are now 80,000 chemicals in our environment. 60,000 of them were not present 50 years ago. You're bringing up the history. And these chemicals have not been evaluated for safety. We don't even know how to measure it. So we also have EMF reactivity, electromagnetic fields. And though everyone taunts the wonderfulness of 5G, there is some very solid research that suggests that 5G is stimulating mold to become more toxic, because mold makes toxins in response to its perceived threat. In other words, a mold, it's very energy expensive for a mold species to make toxin. It doesn't just do it willy-nilly. It does it to keep other molds out of their natural environment. But when it feels threatened, that's when it increases the production of mold toxin. And there's some very interesting research that suggests that the EMF exposure is essentially annoying mold and literally making it more toxin. And I want to add one more unifying concept here. When we deal with toxicity as a concept, the underlying concept that we want to always be aware of is what we call toxic load. That means the cumulative toxins in our environment that we are being exposed to. Mold being perhaps the most common, the most easy to measure, and honestly, even though you get worried about it, it's not hard to treat. It takes time, but it's treatable. So mold gets a lot of the attention right now, but we also should be thinking about the cumulative toxin load that we're all being exposed to, because we've reached the point of no return on this planet. This world is really toxic. And if we want our children and our grandchildren to grow up in a healthy environment, we really have to take this seriously. We can't just keep giving it lip service or saying, oh, but it's too expensive to test all those chemicals. Oh, but it's too expensive to think about how we can get rid of it from an environment. I believe the expense of being exposed as we are is making a host of diseases that we see all the time. Chronic fatigue, fibromyalgia, autism, neurodegenerative diseases of every type, virtually every inflammatory process that we're seeing, some of the illnesses that are super common in physicians' offices. Cardiovascular disease is an inflammatory process. If we add an inflammatory component to that, we are literally predisposing all of us for getting sick. And I'm really not here to freak you out. I'm really here to say we can diagnose mold toxicity. We can treat it. But I am saying that I'm hoping that listeners will look at the bigger picture, because this is not conspiracy theory. This is absolute scientific fact. We can document the increasing levels of toxins in our environment. And with it, we're seeing an exponential rise in all of these illnesses, including cancer.
Yeah.
That, where's it coming from? We are doing it.
Yeah. Yeah. I appreciate you bringing that up, and I thank you. And I agree. I'm sure you know of the environmental working group study they did, God, 10 years ago, where they found over 260 high levels of chemicals and compounds in the cord blood of little babies born into the world. And it's a really sad reality in terms of what we have done. And, I would add to the list of everything glyphosates. Glyphosates are probably not the smartest thing we've ever come up with. It disrupts the mitochondria. It actually distorts the microbiome. It literally changes the composition of the bacteria in our intestinal tract, which are needed for our immune regulation. It causes all kinds of weird things, leaky gut that people talk about. The glyphosates can cause that. So yeah, we haven't done a very smart job managing our environment for sure. And I would agree with you. And I thank you for bringing up that comment that, while we're going to be talking about mold for the most part, it is important to put it in the context of everything else. Now, one of the things, so I think with some of our audience members, when they think about the fact that 50% of buildings have mold, they'll be like, well, that can't be the case. And what I read, so probably a lot of buildings have some degree of mold. Dangerous amounts that create health problems, at least from what I've read and understood, is probably somewhere around 1 in 10 to 1 in 20. So 5 to 10%, if we were to give a number, and we don't exactly know. Is that, do you think, the right amount? So if our audience members are thinking like, okay, what is the probability of me being, really exposed? Is that about an accurate number?
It probably is. I only quoted that number to get people's attention. It's not to make people paranoid or scared. I think it would be more useful for people to think in terms of the health of themselves and their family members, in terms of am I fatigued, or are my children fatigued, or has their school performance changed? Were they straight A bright several years ago, and now they're struggling to make B's and C's? Are they more anxious now than they used to be, or more depressed? Or, I mean, is their bowel habits changing? I mean, are they? Asthma is a good example. When I started out in medicine, asthma was rare. Um, Maybe one kid in a room of 30 children needed an inhaler. When my children went to school, which was 25, 30 years later, um, 20, 25% of the children in the class had inhalers. I mean, and it's gotten worse since then.
Yeah.
So asthma has gone from being rare to relatively common. And again, I think it reflects that exposure to cleaning materials and toxins that have proliferated in school buildings,
Yeah.
where people are using them in ways we've never have before. Again, I don't want to lose the thread of, if there is asthma in your child, don't just think of asthma per se. Mold will create a symptom that looks like asthma, but actually is not.
Yeah.
So
And,
it's something to be aware of.
and folks, I think to kind of highlight Dr. Nathan's point, kids. So I think in just the last 2 years, I found, 3 of the kids, we only have a handful of kids in the practice who have asthma. 3 of the kids who had the worst cases of asthma all had mold exposure. And, when I'm talking worst cases of asthma, like in these kiddos, we were throwing inhaled steroids at them. The pulmonologist was on board, and like they would just keep falling apart. And the way I look at mold is it's the ugly kind of monster hiding in the closet. At least from what I've seen, and I'm sure Dr. Nathan has seen way more cases than I, but when I see these kids and families, it's almost like everything is just up to the nth degree. When you've got asthma, that sucker is nasty, and these kids are wheezing and they're constantly having trouble breathing. We had a mom that was diagnosed with bronchitis, and this poor thing was in the hospital 2 or 3 times getting IV antibiotics and ultimately IV antifungals and IV steroids. And she just literally for 3 months, she could not stop coughing. CT scan, bronchoscopy, and so forth. They had mold. So, folks, I think the way to look at this is we need to start opening our eyes. And that's really the whole purpose of this conversation, right? To create awareness. And we don't want to scare you. That's not the purpose of this. It's really to have everyone stand back and say, like, God, I know of someone who has a really weird presentation of something. And I think when we start looking at things of, when someone has such severe asthma that they can't breathe and nothing makes it better, we're not talking you get a little cold, you have a tiny day or two of coughing and it's gone. It's like cough, cough, cough. Kids who have severe sinus problems, adults too. If you have a serious chronic sinus problem, that may be mold, because mold causes an intense allergy response in the upper airways or lower airways, which can then look like what we call asthma, or look like what we call sinus infection, or look like bronchitis. And these are just the respiratory issues. One of the things, and I'd love to hear what Dr. Nathan thinks, is it also causes weird rashes. So I vividly remember multiple cases where these kids would just break out in hives, and like they were just constantly reacting. And we did, treatments, like we did gluten-free, dairy-free, treat the gut, do this, do that. Nothing would work until we found the mold, got rid of the mold, and voila, asthma cases gone, chronic bronchitis gone, sinus infection gone, weird dermatologic issues gone, because they were having an intense allergy reaction to the mold. In the field of, so let's kind of work through this compartment by compartment, Dr. Nathan.
Let me jump in here.
Yeah, please.
It's not just allergy. Allergy can be a part of it, but it's also toxicity directly. So that when people react in an asthma-like way, they may not be actually having an allergic reaction. It may be the toxicity manifesting that way. So when we think about, we've known about mold allergy for years. Allergists have diagnosed it and treated it. We've been aware of it. Toxicity is a newer concept. So one of the things you'll find in your patients who look like asthma, even to the point that they're wheezing, is if you get pulmonary function tests on them, they're often more normal than you would expect. And the reason is it's not true bronchospasm, it's mold toxicity triggering this reaction. That's why when you get rid of the mold toxin, it goes away. Coupled with the fact, and I know we'll get into this more later, that mold toxicity also causes something called mast cell activation, which can trigger your hives that you described. So you've got to fix what's causing the mast cell activation, which is often mold. And when you do, then the hives go away. So it's understanding the whole process by which mold toxicity triggers a variety of reactions in the body that need to be understood. So, let me come back to where you are going with this. So let's give our listeners an overview of mold toxicity symptoms.
Please.
Okay. All right. So we've already touched on many of them. Anything that involves the respiratory tract, which can be asthma-like symptoms, shortness of breath, a phenomenon called air hunger, where the patient feels like they can't take a deep breath, but they're breathing reasonably well. If you put a little oxygen saturation meter on them, it's 98%. It's perfectly fine. But the feeling you can't take a deep breath is an interesting and fairly unique concept to mold toxicity. Then we have psychological effects, which is intense anxiety, intense depression, OCD behaviors, ADD, ADHD type behaviors. We have neurological events, things that look like stimming or pseudo seizures or dyskinesias, in which patients will have twitching behaviors or move in ways that they look like they're not in control of their nervous system. Those are not rare with this as well.
And sometimes these get called tics. So these dyskinesias that you're talking about, sometimes these kids get labeled as having tics.
Correct. So it looks like autism. And you could even put that label on it, but interestingly, if you treat the mold, it completely goes away.
I love
So,
that.
and a surprising number of kids who are diagnosed with autism have a mold component to it. So it is something that if you get that label, it is something you want to be looking at.
And if I can touch on this, because for all of you out there watching, this is actually, I want to make sure that you didn't gloss over this, because what Dr. Nathan just touched on is super important. First of all, it was Dr. Nathan that brought this to my attention. And he pointed out, and I've really come to believe that probably a vast majority of what we call PANS, or potentially PANDAS, the pediatric acute neuropsychiatric syndrome, and these poor kids, if you see them, I mean, it's heart-wrenching what's happening to them. They're kids that were normal, and then all of a sudden it's like they fell off the cliff, and the parents are like, yeah, it's like a light switch went off, and basically these kids are going completely crazy out of their mind. So when Dr. Nathan says that there's anxiety, and it's a severe anxiety, I mean, folks, like this is to the point where you would almost call it psychosis. And these kids are having these intense reactions. Like, it's not like a little, I mean, sometimes it's a mild, what looks like a tic, but sometimes these kids are literally like having these weird things where they're put on various medications. That the pseudo seizures I've had, Jesus, I think just in the last year or two, probably 4 kids that I could immediately remember off the top of my head, where the neurologist did an EEG and they're like, well, it's kind of a seizure, but not. So that they have these weird seizure discharges, except it's not a true seizure. The anxiety is over the top intense. So this may not be a child that you're having. This may be you, some of you out there who, for whatever reason, you can't understand it. You're like, why is my brain going haywire? And literally, this is, I think, the best way to look at this. It's like the brain just falls apart and it is going completely nuts. So I really want to emphasize this, because what Dr. Nathan touched on is actually really, really important. And Dr. Nathan, would you agree that probably a decent amount of what we PANS or PANDAS is actually mold exposure?
Yeah, very much so. And I want to add to this discussion, I know we're talking about mold, but I want to add Lyme disease and some of the co-infections of Lyme disease, particularly Bartonella, as also a player. So when I see someone with pseudo seizures, it almost always turns out to be mold or Bartonella. If I see people with dyskinesias, it's almost always mold or Bartonella.
Hmm.
Lyme may be a player here as well. So I don't want to exclude that from our thinking. I don't want us to get into the mindset of, oh, well, obviously it's mold. It's like um, no other infective agents. So you asked about PANS and PANDAS. We started out believing that it was triggered exclusively by the strep bacteria. However, we've learned that, surprise, Lyme, mold, co-infections, a variety of viral infections, a couple of other different types of infections, all can trigger this. In my experience, most have mold. And if you treat the mold, you can often make a huge difference in this. In fact, the as you well know, one of the standard treatments for PANDAS or PANS is IVIG, intravenous immune globulin. And unfortunately, when people are in the throes of any type of toxicity or infection, it often doesn't work. The body can't utilize the IVIG until we have gotten the toxicity out of there. So it's also not plugging into some algorithm. Oh, you have this, I give you this. It's understanding, okay, is my patient ready for it? Can my patient respond to this treatment at this point? Or do I have to prepare them by making them less infected and less toxic
Yeah.
right now?
Yeah.
Because that's a very, very important consideration.
I love that. I love that. And, I think to touch on your IVIG point, the other thing that I've seen is, unfortunately, I'm the one that seems to get kind of lovingly who I'm called the train wrecks. And, I've had X number of patients who were diagnosed as pandas and they were put on a year and a half of antibiotics, which further exacerbated the dysbiosis and further impacted their immune system. And sometimes the kids momentarily get better because some antibiotics are anti-inflammatories, so it calms down part of the reaction that the mold is driving, only to then cause things to fall apart again. So guys, these things are really serious points that Dr. Nathan is bringing up, and I really hope that this sticks in your brains and that all of you share this with everyone. And for anyone that's curious and you want to read and understand more, I can't recommend this book well enough. And I get no kickback from recommending this is just a good book with good information, and this man over here is just wise and he has so much wisdom to share. But let's circle back, Dr. Nathan. Help our audience understand why these things happen. Because, oh, and I should add one more thing. Sorry, that just crossed my mind. The other thing that I've seen with some of the kiddos who get hit with mold is that their visual tracking systems get thrown off, which is the weirdest thing. Like, these were kids that were doing fine in school, and all of a sudden they have trouble. They have learning disabilities. They can't read. And when we check their eyes are actually not tracking well. So for some of you folks out there where your kid was doing fine in school and suddenly they're having anxiety, they're falling apart, they're learning disabled, your straight A student is now getting Fs and they're getting frustrated because they can't do their homework. This is what we're talking about. And this stuff is very pertinent for all of you. God willing, none of you ever see mold, and we're going to talk about how it shows up in the home because it's way more common and easy to miss than we realize. But this is so relevant for every parent to know of, because if you happen to have the kid who is sensitive, and 1 in 4 human beings are genetically vulnerable to mold, if mold is there in large amounts in your home and your kid or you happen to be one of them and you get hit hard, you might as well have gotten run over by a truck and everything falls apart. So, okay, now with that piece done, Dr. Nathan, first of all, are there other neurological learning challenges, other things that you want to highlight? And then maybe from there, we can talk about how mold and mold toxins and these other infections basically scramble the brain. How do they do that?
Sure. Well, let's come back to the first question, which is there are other mold symptoms that people should be aware of. One of them is cognitive, which is your ability to reason, think, what we call executive function. In other words, people call mold brain brain fog, difficulty with focus, memory, concentration. A unique symptom is word finding. where you can't find the right word and you know what you want to say and you can't pull it out of your
Mm,
subconscious mind to get you there.
mm,
So cognitive function, along with fatigue, those are two of the major symptoms that we have. And I mean bone crushing fatigue. I mean fatigue to the point where you can't get out of bed, you can't do much. And that's associated with muscle weakness.
mm,
And that's also associated with dizziness, lightheadedness, balance difficulties, having difficulty walking down the hall without putting your hands out against the wall to straighten that out. I mean, these are all common mold effects.
mm,
Gastrointestinal, severe constipation or diarrhea, which sometimes alternate. Um,
mm,
Almost every symptom that you can think of can can be connected to mold toxicity because it's all about inflammation, and we all have our own unique biochemistry, our unique genetics, and we are all prone to having certain areas light up with symptoms sooner than others, so that you may not get every symptom that I've talked about, but you only need to have a few to make us start thinking, oh, I wonder if that could be an
mm,
issue here.
mm,
So, to launch into the next subject, which is how did this happen? Mold toxin triggers in the body an inflammatory process that the body doesn't know how to turn off unless the mold toxin is gone. So, as long as there's toxin in the body has a lot of difficulty dealing with it. It is not even as simple as, okay, my house is moldy, I'll get out for a couple of weeks. That may not change much. It may. You may feel better getting out of your home, and then getting back into it may feel worse. But the problem is, mold will colonize once you've been exposed to it long enough, meaning it will actually start growing
mm,
in the GI tract, in the sinuses, so that even if you leave your moldy environment, it's in you. You are carrying the mold and it is making toxin ongoing. So
mm.
unless we understand that, it baffles people, which is, okay, I thought it was my house. I went on a 2 week vacation and I didn't feel better at all. So obviously it's not mold, can't be my house. And the answer is, well, it can be, but it's not that simple.
Because the person is now moldy. You've become
Yes,
moldy,
yes,
sadly.
exactly, exactly. But again, it's treatable. So just because we're using these terms doesn't mean that there's nothing you can do. But it is important that you understand it, because you can't get well unless you understand these pieces.
Yeah. Yeah. And I think that folks, for all of you listening, this is probably one of the most important things, that we can get things better. And I mean, I've got to tell you, like, part of why we're having this discussion is in some of the patients that I've treated, the 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 amount of change, the amount of benefit is sometimes shocking. I mean, that's the best way to describe it. Like, imagine if you've ended up in the hospital multiple times because you have this horrible breathing issue, and then all of a sudden a month later you do X, Y, or Z things, you address the mold, detox, and you're no longer having it. I've had kiddos who have had, I mean, kind of like what Dr. Nathan is talking about. Imagine adult dementia, except it's in a little kid, and these are kids that are getting kicked out of school, they're failing out of school, they have no friends because they can't manage themselves. And then we heal them, we clean up their system, we detox them, and it's like there's a different human being there. This is the part that is so cool about this conversation. This isn't doom and gloom. This is, you can literally transform a human being's life and take them from being very sickly and falling apart, in essentially, like, you tune them up and they become this shining new person who is thriving, and that is possible.
Yeah, yeah, it's one of the reasons we love doing this work. It's one of the reasons I like treating kids, because you take a child or a young adult who is essentially non-functional. You basically give them their life back. It's so much
Mhm, mhm,
wonderful potential there that gets
mhm.
reinstilled. It's beautiful to
Yeah.
watch. And I've treated 3 or 4 thousand people with mold toxicity successfully. So watching families because it's not just one person in the family, often it's several. Watching families or individuals go from being bedridden to being able to complete college and
Mm.
graduate and go on to graduate school. I have a little file of photographs of some of my teenagers that I've treated over the years that later the family would send me a photo of them in cap and gown graduating.
Oh,
And that's just, fabulous. It's like, okay, it's why we do this work.
yeah, yeah. And sadly, that the flip side of this is if we are not aware of it. And again, guys, all of this is the entire conversation is to have you become aware and to help you hopefully have you help other people become aware. If we're not aware that this is possible, if we're not aware that this exists, and you have someone who continues to live in a home that is constantly exposing them to mold toxin, the opposite can happen where the disability continues and then they become the person who just lives with anxiety, ADHD, chronic fatigue, dementia, whatever, and we just label them as, well, he's just kind of slow and anxious, oh, he's the autistic kid, or she has chronic fatigue or whatever else. We have the opportunity to make a huge difference in the lives, and that's why Dr. Nathan is taking his precious time to come and share. I mean, that's why we're having this discussion, but we need you to also then perpetuate this information to others, because this is really important. Dr. Nathan, in your book, you also talk about the fact that mold also hits the hypothalamus and the pituitary and basically changes our entire hormonal axis. So the adrenal glands get thrown off, the thyroid gets thrown off. Ladies can have all kinds of estrogen imbalances. We can have significant difficulty losing weight. So to just put this in context for some of you out there where that piece matters, weight loss can become a big issue. Mold really does a number on the entire system.
Yeah, it does. And you're correctly pointing that out. So mold, basically, think of it as this huge inflammatory process. And if we inflame the pituitary, which it does, then we are profoundly affecting, as you're correctly pointing out, the body's ability to regulate adrenal, thyroid, sex hormones, and several other hormone groups as well. Those are the biggies.
Hmm.
So it's extremely common for our patients with mold toxicity for us to look at the hormone imbalances and correct them. Because even if we remove the mold toxin, the system doesn't always reboot itself automatically. We sometimes have to intervene and get the thyroid back in balance, get the adrenal back in balance, get the sex hormones back in balance. And at that point, then the body goes, oh, okay, my normal homeostatic mechanisms are coming back into play. Okay, I remember how to do that. Cool.
Amazing, amazing. Could we circle back? How does mold do such a number specifically on the brain? So I have yet to find someone that can help me understand why the vision tracking happens. I know mold hits the limbic system, which is ultimately how we have emotional regulation, which is why a lot of these kids have significant difficulty regulating themselves and their emotions. But if you can help our audience understand, how does mold really impact the brain? What does it do, or do we know?
Well, we know some things. I don't know that I can explain the tracking process, which
Okay.
I've seen. Um, so mold specifically affects certain brain areas that we do know about. We talked about affecting the hypothalamus and the body's ability to regulate hormones, but it also specifically affects what we call the limbic system, and it also affects what we call the vagus nerve system, which I'll talk about separately. The limbic system is the part of the brain that regulates emotion, sensitivity, and to a certain extent, cognition, energy, and pain. But the two key areas that are unique to the limbic system is sensitivity and emotion. So if you have a patient who has a pretty straight shooter, never really had anxiety or depression, and all of a sudden, out of the blue, they're extremely anxious, they're extremely depressed, think limbic system. The other piece of that is the limbic system regulates our response to our environment, both internal and external. And what I mean by that is patients who get a limbic involvement become increasingly sensitive to light, sound, touch, smell, food, chemicals, and EMF. Could be all of them, could be some of them, but when you have a patient who describes that sensitivity, they are telling you they've got a limbic piece to this. And mold toxicity triggers it. By the way, so does Bartonella. And but when you treat it, it will go away. But you sometimes can't treat them unless they reboot their limbic system while you're trying to get the mold out, because that super sensitive system may not allow that patient to take the supplements that they will need to pull the mold out of their body. It won't allow them to. They become so sensitive. So if you've got someone in your family who's become so sensitive that they can eat 10 foods, they just can't eat more than that. They try to take a homeopathic, and a single drop of a homeopathic throws them under the bus. That's limbic.
Hmm.
Working with the limbic system to monitor safety in the body is what Stephen Porges calls the vagus nerve system. And the vagus nerve system involves obviously the vagus nerve, which is the 10th cranial nerve, but it also involves several other cranial nerves as well. And that includes cranial nerve 9, 11, 5, and 7. So that 5, it involves facial muscles, for example. It involves how you express yourself. It involves swallowing, which is the 9th cranial nerve. It involves tension in the neck and shoulders, which is the 11th cranial nerve. Now, I don't know that this is the case, but I suspect when you get some of this type of cranial dysfunction, you are probably affecting 3, 5, and 6, which are the ones that affect the ocular muscles, so that the ability to track probably is connected with it. And I don't have any specific data to prove that, but I suspect that we're seeing an override or overlap of other cranial nerve dysfunctions that is closely connected to. So for example, 5 and 7, which is the facial nerve and the trigeminal nerve, facial nerve 6 is right in between them. And that controls some of the muscles of the eye. It's not that much of a stretch to think that 6 would be affected as well.
Yeah. As you're saying this, what occurs to me, and I've seen this in a bunch of the patients, are, just weird manifestations that these people have. So in your book, you talk about how some of these people have light sensitivity. One of the things that I see in a lot of the kids is they develop these weird oral aversions kind of out of the blue. So it was a kid that was eating fine and suddenly is having all kinds of weird texture issues. They can only handle a few things. And I mean, folks, just imagine if your kid or your brain is just lit on fire and everything is kind of falling apart. And the way the brain is processing information goes off. So sensory processing disorders on crack. So like there are regular sensory processing disorders, and then there are some kids that literally like anything throws them off. Everything just causes them to explode. They can't handle anything in their mouth. When you see something where you're just like, what is going on in this human being? And it's just this myriad of weird symptoms that seem to have no common thread. And this is the thing. If you guys look at all of the things that Dr. Nathan has talked about, we can have respiratory issues, we can have hormonal issues, we can have gut issues, we can have skin issues, you can have chronic fatigue, you can have muscle issues. When you put these clusters of things together, it's actually really interesting. When I look at a patient and it's just like, oh my God, they got run over by a bus and they have this constellation of weirdness, one of the first thing that goes through my head is mold, and then some of the co-infections that Dr. Nathan has talked about. So there's ways to contextualize this. Dr. Nathan, I'd love to zoom out a little bit with the time we have to kind of put other things in context, if that's okay with you.
Sure.
So, folks, I think to go back now, some of you, and this is what happens in my office all the time, you'll be like, well, we don't have a water leak. We're in a brand new home. There's no way we can have mold. And what I can tell you is that I've had multiple families, and I've only treated maybe, I don't know, 50, if I'm lucky, 100 patients with mold, if that. Nowhere near what Dr. Nathan has. But we've had folks in beautiful multi-million-dollar homes that are like 2 years old, and the dude that installed their AC unit happened to forget to hook up the drain. And this AC unit is now infested with mold because the water isn't draining out of the AC unit, and the AC unit is the reason for mold. We've had families with front-loading washers, and the washer became infested with mold. We've had families where their house was fine, but in the subspace below it, there wasn't enough drainage, and that became infested with mold. If you have a retaining wall and your house is next to a hillside, if that retaining wall in your house is right up against it, if that retaining wall isn't draining, that retaining wall is going to send moisture right into your home. And guess what? Moisture plus drywall equals mold. Other things that I mean, I'm sure you've seen hundreds of different ways that it showed up. And the reason why I want to bring this up is one of the things that I keep hearing people say, well, it can't be my house because my house is this. And the whole point of what I'm bringing this up is, yes, it could be your house. Somewhere between, if we're using conservative estimates, somewhere between 1 in 20 to 1 in 10 homes have this, period. And statistically speaking, there are thousands of you out there watching that may have mold in your home. So everyone needs to be thinking about it in this way. What are other ways that mold problems occur? So we talked about the washers, the AC units. What else have you seen outside of the obvious? We had a flood and half the house got damaged with water.
So I want to bring up a whole other piece to this.
Please.
The things you're bringing up is absolutely fine and correct. You may not have mold in your current home, but if you were exposed to mold in a previous home, you could be, as we said, carrying it in you. Or it could have affected the items in that home and you brought them along with you. So particularly papers, books, things like that are particularly hard to get rid of, and those things can contain mold spores and reseed the new house. But the key thing is we've had patients who lived in a moldy environment 3 years ago, 5 years ago, 10 years ago, 20 years ago. And as far as we know, the current environment they're living in is safe and is not moldy. It doesn't change the fact that you still can have mold toxicity that you acquired somewhere else. And it's not rare. I just want to make it clear that the other piece that I would comment on is it's natural for human beings to go into denial that their home is moldy. The first thought that goes, oh my God, will I be able to sell it? Oh my God, can it be fixed? This is going to cost me a fortune. So the natural response is denial, which is not my house, can't be. So one of the things that I will often do is I'll ask people to get hold of what we call mold plates, which are simply petri dishes that grow mold. And I'll ask them to take a mold plate and put it in every room of the house. You simply take the top of the petri dish off, put it on the floor of the room, let it expose to room air for 2 hours, put the top back on and see what grows. And for many people who are in denial, when they see what's growing on those plates 4 to 5 days down the road, denial tends to evaporate in the face of, oh my God, that is an ugly plate. That's growing in my house. Then we analyze the plates, and if truly toxic species of mold are growing on those plates, then we can say, I know you don't want this to be the case, but you or your family members cannot get well if you stay in a moldy environment. Can't be done. Yeah. You can't get well living here. So it's important to get people's attention, sometimes lab work on a piece of paper, or sometimes getting the urine mycotoxin tests that we do will light it up, where people will get the test back and go, oh my God, that's a lot of mold in me, or my child, or my spouse, or whatever. That those pieces of lab work help us break through the denial that is inherent in this situation, because no one wants to deal with this.
Yeah. Yeah. Uh, I know in your book you talk about the ERMI test. So let's say we've got now the attention of some of our audience members, and they're like, "Well, gosh, could my house be moldy?" Would what else would you recommend for them to do to see if this is real? And then maybe we can talk about how they can find doctors like yourself. I'm sure I don't think you're taking new patients at this point, if I remember correctly. You're
That,
busy enough.
no, that is correct. I do a lot of consultation work, as you know, in addition to my office practice, but um, I have on my website a list of practitioners that I've trained, mentored. And so that's a very good place to go with people who I know what they're doing.
Great.
So my website is simply neilnathanmd.com. And there's a list of practitioners there. It's probably um, as good as any as a starting point. The ERMI test involves vacuuming up dust from a particular room that you're analyzing it and mailing that dust into the ERMI laboratory where they will analyze it for the amount of toxic mold present. It's a bit more accurate than those mold plates, um, also a bit more expensive. I kind of like to combine them by starting with mold plates, because what the mold plates will tell me is where should we be looking,
Hmm.
so that you may have nothing growing on, if you have like 8 plates that you're checking out, nothing grows on 6 of them, but 2 of the plates are growing it. Then we can hone in on where that is. We can do an ERMI test on those rooms and see how moldy that is. So that if you need to call in an expert to look at the possibility of remediation, like what's causing this, is it as simple as the carpet's gotten moldy, I just need to pull up the carpet, or is it one small area that had a leak that we can fix? But you got to start with, where is this coming from?
Yeah. Yeah.
You know, on these mold plates, for example, if every plate that you check has the same species of mold growing, that suggests that the HVAC system has gotten involved and it's basically blowing mold spores all over the house so that it's universally being deposited. So it tells us, okay, let's look at the HVAC system. Um, it just helps us to hone in on what we need to do so it's not quite so overwhelming.
This is a conversation about creating awareness and for us to become more intelligent about how we look at the problems that we as a society, we as individuals are facing. The beauty, and Dr. Nathan has said this multiple times, and I've said it, the beauty of this is once we become aware that the problem is there, like the mold, and you do the little mold plates, you do the ERMI tests, you find the doctor, whatever it is. Once we start taking action, what is incredible is that the horrible, serious, severe consequences of the mold can then be reversed. And potentially the lifelong state of illness. And if you guys heard, I did touch on the fact that a lot of the things that Dr. Nathan talked about look very much like dementia. So if you're the 35-year-old that's looking and being like, my God, like what is happening to my brain? Like I can't remember anything. Am I becoming demented? Am I developing dementia? This could be mold. And we could do so much. We could do so much to heal kids, to help you, to help elderly stay healthier longer. But this all starts with awareness, which was the whole purpose of this discussion. And it starts with us sharing information with others so they can become aware. Dr. Nathan, I'd love to hear what would you like to add? What would you kind of like to leave with our audience and impress upon them?
I always like to leave on a note of hope, which is that this is treatable. I have successfully treated several thousand people with this particular illness. So although it might seem scary to have the diagnosis, it's much scarier to not have a diagnosis. It's much scarier to go to a major university center and be told, I don't know why you're sick. Um, it doesn't make any sense to us. This is an answer for tens of thousands of people who can get the help that they need if they will simply open up their hearts and mind to this possibility so that they can get the treatment that they need.
I guess with that, let's close. Dr. Nathan, thank you so much for being here. Thank you so much for taking the time. You're a super, super busy man. You've got a million things going on. So I'm grateful that you took this time to share. And thank you all in our audience who took the time to listen. And hopefully you feel that this is worth sharing with other people.
Thank you for giving me the opportunity to share.